I'm Dr. Puneet Kapur. I'm one of the adult emergency medicine physicians in Saskatoon, and other roles I hold, I'm the medical director for Healthline 811 and also the physician lead for the virtual physician programs in Saskatchewan. I interviewed at emergency medicine training programs across Canada, as you do in your last year of medical school. I came to Saskatchewan in the winter of 2013 and had an amazing welcome here. It was one of the newest, youngest, boldest emergency medicine training programs in Saskatchewan. I felt it had a very personal and intimate feel. It'd be a place where I could train and be well taken care of, and having a very personalized, specific, oriented to me training experience. So when it came time to pick spots, I ranked Saskatchewan amongst my highest because of the great welcome, the warm welcome I had received here. And then when the match was complete, I ended up in Saskatchewan. But I've been here 13 years now, and I definitely call it home. So my daily life has changed absolutely for the better. So having grown up in Toronto, trained at the University of Calgary for med school, and done fellowship at UT, so I no longer commute 6 hours round trip to get to work. I can walk to City Hospital from my house. There's plenty of all the basic needs and necessities you would want in life, and it's very easy to get along. You can meet a friend for lunch, go to the gym, run your errands, and still be home in under 60 minutes. And I would challenge anyone to do that in a larger center. The other thing I very much enjoy about practicing in Saskatchewan is that many of the people I interact with on a daily basis, I either trained under or they trained under me. So that gives me a really intimate practice environment. When you pick up the phone and you talk to someone, you're undoubtedly on a first name basis, or you've known each other personally or professionally over all the years. And because we're a small center, but still an academic center, there's an abundance of academic and research opportunities outside clinical medicine. You don't have the same degree of competition that you might have in some of the bigger centers, and that has really allowed me to grow my career outside of simply the clinical domain. Two of the additional roles I hold, I'm the medical director for Healthline 811, and I lead the virtual physician programs. The work in the virtual physician program is perhaps some of the work I'm most proud of. One of the things we do through Healthline 811 is we have doctors available, so you can call from the comfort of your own home and speak to a physician. Saskatchewan offers abundant opportunities outside of clinical medicine. Because Saskatoon in particular is the home of the medical school, there's ample support for research. It's encouraged, there's funds and additional support services available. What excites me about advanced ultrasound is twofold. I am very thankful to Saskatchewan that let me go away for a year for advanced training. Most provinces don't allow that much time away from your home province, but the Ministry of Health and the Saskatchewan Health Authority supported me to go to the University of Toronto and do a fellowship, gain those advanced skills, and bring them back to benefit the citizens of Saskatchewan. So that's from a research perspective, from an academic perspective. As the folks in the College of Medicine would tell you, they're always happy to have new staff to be mentors for medical students or doctors in training. I find that aspect of my career immensely rewarding, to mentor the next generation of emergency physicians. There is a indescribable joy in seeing folks that you met when they'd been a doctor for exactly one day, then graduate to become full staff physicians. Because we're a smaller center, it's a much more intimate training environment. People are happy to hear your perspectives. There's much more of a personal network with your peers and leaders. When I pick up the phone and want to speak to a consultant to get some advice or some help with a diagnosis or treatment, invariably I either trained under them, and we have a professional working relationship, or the converse, as they trained under me, and I've been part of their training journey right from the beginning. And that one-to-one personal interaction can't be underestimated. It leads to better conversations. It leads to better professional collegiality. It's one of the things I wish more physicians knew about practicing in Saskatchewan is because it's one integrated health authority, I think it allows for much more seamless care. Having worked in larger centers, care is really fragmented. Information on patients' diagnoses, medications, treatment plans is scattered all over the place. Among the other advantages of working in Saskatchewan is the fact that we have a pan-provincial electronic health record system. So the ability to go to a single unified software solution where you can find out their medications, their treatments, their surgeries, all their past lab results allows me to deliver much better care. The rates of pay are definitely competitive with the rest of Canada, balanced by the much lower cost of living. The quality of life in Saskatchewan is exceptional. I can only speak from personal experience, but you can cross-country ski 10 minutes from my house. There's jogging trails and bike trails, and you can buy an affordable home in a nice part of town. I often reflect back and think about how much I enjoy living in my new home in Saskatchewan. Something similar in Toronto would probably start at about $2.5 million. So quality of life is the big component. And the second part, I think I've alluded to in other conversations, you're well supported by the College of Medicine and the Health Authority. If you have an idea, an initiative, an area of focus you'd like to enhance on, then the Health Authority is happy to hear those ideas and help you grow out. I think that's something that's unique to our province. Saskatchewan is calling. Grow your practice, grow your life.